What were the earliest successful lung transplant breakthroughs? Imagine a world where ending severe lung disease was possible with a single operation. That dream became reality through a series of important steps in medical history. The first human lung transplant was performed on June 11, 1963, by Dr. James D. Hardy and his team at the University of Mississippi Medical Center. They transplanted a left lung into John Richard Russell, a man convicted of murder. The surgery showed that a transplanted lung could work inside a person, but Russell only survived 18 days. An autopsy revealed no rejection, meaning the lung was functioning well, but technical issues caused his early death. This proved that lungs could be transplanted and function normally, even if success was limited at first. Between 1963 and 1978, about 36 lung transplants took place worldwide. Most recipients died within days, and only to survive longer than a month. The main problems were immune rejection and difficulties in reconnecting the bronchial tubes, which carry air to the lungs. These technical challenges kept the field from advancing until new solutions appeared. The breakthrough came in 1981, when Dr. Bruce Wrights at Stanford University performed the first successful hot lung transplant. He combined the lungs and heart into one procedure, which helped reduce damage to the windpipe and improved survival. Then, in 1983, the Toronto Lung Transplant Group, led by Dr. Joel Cooper, achieved a major milestone. They successfully transplanted a single lung into a patient with severe pulmonary fibrosis. The patient's oxygen levels improved immediately, and imaging confirmed the new lung was working well. Although the patient died 18 days later from kidney failure, he had survived long enough to show the procedure could work. By 1986, this patient was alive and living a normal life, surviving 4 more years. Key technological advances made these successes possible. The invention of the hot lung machine allowed surgeons to keep blood flowing during complex surgeries. The development of immunosuppressive drugs like cyclosporine, approved in 1983, greatly reduced rejection episodes. This medication allowed doctors to lower steroid doses, which helped healing of the bronchial connections. These innovations made lung transplants safer and more effective. Initially, only patients with pulmonary fibrosis were considered good candidates. But in 1988, a successful single lung transplant was performed on a patient with Chronic Obstructive Pulmonary Disease, or COPD. This opened the door for more COPD patients to consider transplantation. Later, in 1986, the first double lung transplant for emphysema, a form of COPD, was performed by Dr. Alexander Patterson. The recipient, Ann Harrison, lived nearly 15 years after her surgery. Over time, surgeons refined techniques to improve healing and reduce complications. The development of methods like omentopsy and telescoping bronchial techniques helped ensure better connection of the airways. These improvements, combined with better drugs, led to more successful lung transplants throughout the 1980s. For patients with COPD and other severe lung diseases, these breakthroughs turned lung transplantation from a risky experiment into a real treatment option. Today, lung transplants are a vital part of managing and stage lung disease, giving many patients a new chance at life.